Hi, everyone. Welcome back. My name is Dr. Samantha, and I'm the maternity mentor, and I'm here for another one of our Monday live Q&A sessions. This is where I have a chance to answer your questions live, as well as answer any questions that you may have put into some of our videos this week. Remember, you can follow us on social media, and please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. Also, if you hit the notifications bell, you can be notified of our latest content coming out. And for those of you who stick around until the end, I'm going to give you a sneak peek at tomorrow's video. So remember, please feel free to put your questions into the chat. And in the meantime, I'm going to go ahead and get us started with some of the questions that came in this week on the videos. So we're going to start off with a very common set of questions that we get, which is on bleeding. And we had 3 different questions about first trimester bleeding that all were really good questions and kind of highlight different things that we think about during the first trimester and bleeding. So the first thing is, I just want to ask, I've experienced very light brown discharge for about 4 days. And today I had a small, dark red clot along with light cramping in my lower abdomen up to my legs. I missed my period almost weeks. Can you please advise me? The next question was, is the HCG very accurate? Can it tell how far along a person is in their pregnancy? So I've decided to combine these 2 questions together because it's a great way to start off bleeding. So bleeding can happen for a variety of reasons. During the first trimester, starting with the hormones that help you have a healthy pregnancy, these hormones can thin out vaginal tissue. And because they thin out vaginal tissue, it's very easy for you to tear or get micro tears, which cause some bleeding. So once we have bleeding, it's important to identify what's going on. So for starters, you can have bleeding from placenta issues. You can have bleeding from a subchorionic hemorrhage, which we'll talk about a little bit later. You can have bleeding because you're having your first period. Oftentimes, you will actually have your first menstrual cycle before you even know that you're pregnant. And it's because your body's still kind of trying to really figure out what it's doing. So that's actually very common. Now, one of the things you need to know is how to identify what kind of bleeding is happening. So brown, as is mentioned in here, brown is old blood. That means there was some active bleeding and it's resolved. Red is usually a sign of active bleeding. And it's important to understand these terms. And I have a video on it because if you call your doctor, or if you present with bleeding to the emergency room, they're going to ask you a whole bunch of questions. And just so you guys know, oh my gosh, hi Nairobi, Kenya. Thank you for joining us at 4 a.m. I feel very honored. Just so you guys know, it is not unheard of if you guys have a camera and you want to take a picture of something that you see to show a provider what's going on, that's okay. A lot of people get a little weirded out because, when we talk about blood and discharge and different things, we think of it as kind of gross, but for healthcare providers, we're used to it. And so if you're not sure what you're looking at, what the color actually is, believe it or not, you can think it's one color and we would call it a different color. If you're not sure, is this small or big, what's going on, taking a picture of it to show us, because now a lot of us have the camera phones, that can actually help us to get data. So that's one of the things that you can do for sure. So once you have determined that something's going on, the most important thing is for you to call your healthcare provider so that we can do an ultrasound. Ultrasound is kind of the standard number 1 when you are experiencing bleeding early in your pregnancy. Now, going to the HCG question, which I kind of combined with this, HCG is human chorionic gonadotropin. This is the hormone that we measure. The hormone that we measure in order to determine if you're pregnant. Now, when you guys pee on a stick at home, the home pregnancy test, that's what it's measuring. It's measuring the presence of that, but it doesn't give a number. When we draw your blood, we can actually get a number for that HCG level. And then what's supposed to happen is that number is supposed to rise. And if you guys check out my video on what to ask for in the emergency room when you're bleeding, that goes into this as well. But the HCG level should rise a certain amount every 3 days. So in 3 days, we have you come back, we draw the blood again. If it rises within that time, the appropriate amount, then we know the pregnancy is most likely doing well, even if there's active bleeding, and that, we're looking good. If the level stays the same or decreases, unfortunately, that means you're most likely experiencing a miscarriage. HCG levels are pretty accurate. They are more accurate as time goes on, and then after a certain period of time, they're irrelevant again. Now, one of the things you guys should know is that one of the things that can sometimes kind of muddy the water and make it a little confusing when it comes to HCG levels is if you happen to have been pregnant with twins and are miscarrying one of them, okay? If you are miscarrying one twin, which may not even be seen on ultrasound when you present for bleeding, your HCG levels may be a little off. So you could actually see a higher than what you would expect HCG level that then falls, but doesn't actually fall below normal for a singleton pregnancy, because 2 babies will be a higher HCG level than 1, 3 will be higher than 2, etc. So that is one thing that kind of muddies the water. Okay. Now, the last kind of question to start out with bleeding was, can you have sex when going through this? And that's a very good question, because oftentimes we will see people that are actually, having bleeding, and they're not sure whether they are allowed to have sex. So you need to make sure that you're talking to your healthcare provider about this, because your healthcare provider is the one who's going to actually advise you. A lot of women can spot during the first trimester and still have sex, especially depending on what the cause of it is. Okay. So these are some of the things that are very, very, very important for you to understand. Okay. Now, please post about maneuvers, malpositions, and suturing. If those are video requests, some of those I could do. Actually, I've been thinking about doing positions of babies. Suturing skills is not something I have, but I do have a video on episiotomies, like tears during pregnancy and preventing them, if that's, I think, what you're asking about. But please feel free to clarify. Let's see. So one of the things that we had that is a cause of bleeding that I want to tell you guys about is subchorionic hemorrhage. And this is really, really, really good to go along with this. So it said, my ultrasound report from 4 days ago says I am 7 weeks pregnant. Fetal heart rate is 128. CRL is 9 millimeters. It also says that there is a small subchorionic hemorrhage measuring 10 times 2 millimeters. Though it says small, it's larger than the baby that's 9 millimeters. So is it considered small, medium, or large? I am taking progesterone injections twice a week and tablets too. I have no bleeding. So there's a lot of stuff in this one. So let me start with explaining to you what a subchorionic hemorrhage is, okay? So you have your uterus and you have your placenta, okay? And this side of your placenta is going to end up being all blood vessels, and it attaches to the side of the uterine wall, which is going to be all blood vessels, and they kind of intermix together. And they create this bed that helps to feed the baby. So blood and nutrients go in and toxins and stuff come out. Okay. And this is that exchange that happens throughout your pregnancy. Now, when this attaches, you got a whole bunch of blood vessels here. Now, if any of you guys have ever bumped your arm, I hope that some of you may have seen a bruise. So the bruise is where you bump your arm and you get that black and blue spot. So what that black and blue spot is, it's actually blood vessels that have broken, and you get a pooling of blood underneath your skin. A subchorionic hemorrhage is simply a pooling of blood underneath the placenta, kind of like a bruise. Now, just like your bruise, the bruise can start out big, and over time, it gets smaller and smaller and smaller and lighter and lighter and lighter as it resolves. Subchorionic hemorrhages are often the same thing. So for starters, your placenta starts out teeny, teeny, tiny. And then over time, this placenta, which is even smaller than this when it starts, is going to get bigger. And it's going to be big. Some placentas are like this big when they come out. They really are kind of like ginormous. And so that little subchorionic hemorrhage. So if you've got a placenta that's this small and the subchorionic hemorrhage is that big, look, that's like huge compared to that placenta. But if that placenta is that big, it's way different. If the placenta is this big, that is like way different. And it still could be the exact same size as the original measurement you see. So that is a resolving subchorionic hemorrhage in many ways because it's getting smaller and smaller compared to the size of the placenta. The other thing is that it is also potentially just going to go away altogether. A lot of subchorionic hemorrhages are found by like accident. They're just there because we're doing an ultrasound for some other reason. If you're not bleeding, it's usually a good sign that nothing's going to happen. But sometimes that pooling of blood that we're going back to, well, if it's kind of down on this edge, a little bit can drip out. And then that drips down, and that's bleeding that you see in the vagina. So that's one of the reasons why we will find them when somebody presents saying that they're having some bleeding. So subchorionic hemorrhage is one of many causes of bleeding. Now, you can have bleeding into the second trimester. So if you are having bleeding, we had somebody comment that she was having bleeding at 16 weeks pregnant with pink and brown discharge. She said, "Can you tell me about this? I'm worried." So any discharge that you're finding, you need to make sure that you are going so that they can get you checked out, because discharge can often be a sign of infection. An infection can actually cause you to bleed. Different infections will actually make the vagina very, very raw. And if the vagina is raw and the tissue is very inflamed, it will also cause you to potentially bleed. So a couple of the infections that you might have that could cause that include yeast, urinary tract infections, and just like the STDs, bacterial infections, stuff like that. So, kind of moving along, and any of you guys who are joining us, remember, feel free to put questions into the chat. But one of the things that you can have is you can have yeast infections. Okay. So we had a question. I'm 39 weeks pregnant. Can I take Canesten vaginal tablet, 100 milligrams for 6 days at this moment? I can't go to the hospital. So yeast infections are one of the things that we see very commonly during pregnancy amongst other infections. Part of the reason why women will get infections at a higher rate during pregnancy is because you are immunocompromised. This is also why we stress vaccines, and I'm going to talk a little bit more about vaccines in a little while. So because you are immunocompromised, you are at a higher risk for developing a wide variety of infections. And so starting with yeast, the vaginal flora, flora is like the normal bacteria that is found in your vagina, can change. And as a result, yeast can overgrow. So a yeast infection often has like a white, chunky discharge to it. It can smell a little bit sometimes it won't. If you're having any kind of discharge, you need to go to your doctor so we can swab you. What we will do is we will take a sterile Q-tip, okay? And we're going to go in and we're going to take just a little sample of that discharge, and we're going to send it to a lab because we need to figure out what is that discharge. Is it normal discharge? There is normal discharge during pregnancy. Is it semen? If you're having sex, it could be semen. Is it yeast? Is it viral? Is it bacterial? Is it urine? Like, what is it that we're seeing? Amniotic fluid is another one. So we can send it off and see what it is and then how to treat it. Yeast infections are complicated because a lot of times we are tempted to take something that we can find over the counter. So in this question, she mentioned she can't go to the hospital. Can she take this? You never want to take anything unless it's been prescribed by your doctor, because there's a wide variety of reasons why you should or should not use different products. If you're talking about creams or suppositories, depending on your pregnancy and if you're high risk, your doctor may not want you to insert anything in the vagina. If you are taking an oral pill, there's a wide variety of reasons why we wouldn't want you to do that. The other thing you need to understand is any infection, including yeast infections, puts you at high risk for miscarriage, stillbirth, and preterm birth. At 39 weeks, unless your doctor has checked you out, you don't want to take anything without talking to them first. However, if your doctor did prescribe Canistan, it is usually considered safe for pregnancy and it should be just fine. So that's a good one. Now, moving along to urinary tract infections, which is another big thing. So urinary tract infections are also very common. And I will tell you, I have seen them really be very hazardous to having a preterm birth, especially in the second trimester. I've seen a lot of preterm births second trimester due to UTIs. So here's the start of it. So your outside genital area, you have the vagina, you have the opening for the vagina, and right above it, you have your urethra. It's like literally right above it. It's below your clitoris and it's above the vagina. So that urethra is a little teeny tiny tube, and it is seriously small, guys. It is tiny. And it leads into your bladder, which is like a balloon. Okay. And this balloon holds your urine. Okay. So it is normally, it's supposed to be kind of compressed, and then it fills up and then you pee and it goes back down. Okay. Now this urethra, which is really really small, it's right next to the vagina and the anus. So the reason why we tell women to wipe front to back is because if you wipe back to front, meaning from your anus forward, you can actually drag bacteria into the urethra. And it takes like no time for it to go boop, boop, boop into the bladder. Now, what prevents a woman from getting a urinary tract infection all the time is the fact that first, if you're drinking plenty of fluid, you can pee it out before the bacteria has a chance to actually grow and develop into an infection. And two, if you're not immunocompromised, your body has defenses to help fight that bacteria off. But when you're pregnant, there's a couple issues. For starters, first trimester pregnancy, you are oftentimes like nauseous and stuff. So what happens is you don't often drink or eat as much as you should, which means you're not going to pee as much. Number two, you have a baby who sits on this bladder so that you can't quite empty it all the way, which leaves bacteria in there to grow. And number three, you're immunocompromised, so you don't really fight off infection like everybody else does. And number four, you don't want to drink as much because that means you're going to be peeing all night, which is very common for pregnant women, aka all the biggest risk factors for developing a urinary tract infection. So you get a urinary tract infection and we treat that with antibiotics. And a lot of people are like, well, I've had them. They're no big deal. But again, pregnant women are immunocompromised. You get sick faster. So out of the bladder, you've got two ureters. Okay. They're also small tubes that lead to your kidneys. Okay. Your kidneys are designed to filter your blood. So you get a lot of blood vessels in that kidney. And what happens is if you get that bacteria traveling up into your kidneys, you can get a kidney infection, which is called pyelonephritis. Now, pyelonephritis is a very serious issue. It comes with fever, chills, and a lot of achiness, flu-like symptoms. If left untreated, pyelonephritis very quickly turns into sepsis. Sepsis is a systematic blood infection that can affect other organs, causing organ failure. And if left untreated, it can lead to a risk of death in the mom. So as you can see, a medical emergency. And this can all start from a simple UTI. Now, I've had patients who've come in with an aggressive UTI, and within 3 or 4 hours, even though they're in the hospital with IV antibiotics going, within 3 or 4 hours, they have a temperature of 105 and they're not doing well. It can happen that quick. It just depends on where your immune system is at. And we've had to do emergency C-sections to deliver these women because if we don't get the baby out, the baby goes at risk. Now, you guys might be saying, why is the baby at risk? If you develop sepsis for any reason, remember that's a blood infection. What are we feeding your baby when it's inside your belly? Your baby is getting nutrients from your blood. So remember this placenta, it's all blood vessels attached to your uterine wall, which is all blood vessels. There's an exchange of blood. And so this blood travels through the placenta. The placenta filters out a lot, but it doesn't filter out everything. And so sepsis is a high risk for babies because they can get septic as well. So once we have sepsis going, very often we will deliver the baby because it's going to be better for mom and baby, depending on how far along she is in the pregnancy. When I say all of this to you, it's to go back to that beginning step. When women get urinary tract infections, they're often really scared to take the antibiotic. And unfortunately, there's a lot of stuff out in the world that says, oh, you can just treat it naturally, no big deal. Once you have a urinary tract infection, there is no natural cure for that. Now, there's a lot of preventive measures. For starters, drinking lots of fluid. The more you drink, the more you pee, the less likely the bacteria can sit in there. Number two, cranberry. Now, let me explain the cranberry stuff. Cranberry is not going to kill bacteria. It's not going to treat a urinary tract infection, but it will make the bladder and the urine very acidic, which makes it not an ideal environment for the bacteria to grow. And I'm very much about homeopathic stuff. Guys, like as long as you don't have the infection, please drink lots, try to treat it, stuff like that. But once the infection is there, you want to go ahead and take the antibiotic if they prescribed it to you. So one of the questions that we got was we had a couple questions about antibiotics. So before I go into the specific questions, let's talk about antibiotic use. When you're taking an antibiotic, many people have heard about antibiotic resistance. Antibiotic resistance is when we start an antibiotic, we don't finish it, and the bacteria that are present develop a defense against that antibiotic, and now it no longer works. So for starters, what is going on is this. You have like lines of bacteria, and when you start taking that antibiotic, it starts killing off lines of bacteria. But the guys in the back, they're paying attention and they're trying to build and mount a defense. They're building a wall, okay? And so what's happening is you're killing it off, so you start to feel better and you stop the antibiotic. And so for a day, you feel much better. But these guys are still here and they build a wall and they bring in reinforcements. Then about 2 days later, you start to feel worse and you're like, oh gosh, I should have finished that antibiotic. So you go back to it. But now it doesn't work because it kills off some more and it hits the wall and then it's done. Can't get through. And now we have to give you a stronger antibiotic. And that stronger antibiotic may actually be more risky. I mean, we're going to give you something that's safe for the baby, but maybe it's a little bit stronger and something we try only to use as a last resort. And so if you imagine when I'm saying that to you, then you can imagine why it would be better for you guys to just take the antibiotic that we've given you up front. So a couple of these questions, one of them said, I'm currently 8 months pregnant and was diagnosed with a urinary tract infection. The doctor at our local hospital gave me cefuroxime Axetil 500 milligrams to be taken twice a day for 7 days. My OB was not available. But 2 days after taking it, I felt itchy in my genital area. I am currently on my 4th day of medication. I was diagnosed with a UTI way back in my 2nd trimester, and my OB gave me co-amoxiclav to treat it. I also felt itchy in my genital area while taking these antibiotics. I went back to my OB, informed him of the condition, and he said my UTI was gone already and that what I was experiencing was BV. Why do I always feel itchy down there when I take antibiotics? So, couple things of this. This was a great question. Hi, Obapa. I'm going to answer your question. So, hold tight. So, this is a fantastic question. So, antibiotics kill off bad bacteria. Okay. So, they kill off the bacteria that causes that urinary tract infection. Unfortunately, they also kill off good bacteria. They can't tell the difference. So your vagina has good normal bacteria. That's what we call vaginal flora, like I mentioned earlier. So when you take an antibiotic, oftentimes that vaginal flora, it kind of it goes away, and the vaginal flora, the good bacteria in your vagina, helps to fight off yeast. So unfortunately, a lot of women, as a result of antibiotics, will get a yeast infection as well. And yeast infections, if you check out my video on yeast infections, we'll link that into the description. Yeast infections can cause itchiness. So one of the things that may be happening is you might be itchy because you're starting to develop a yeast infection. One of my best tricks for that, if you're taking antibiotics, take it with a probiotic. Probiotics are fantastic for helping to keep the vaginal flora intact. Now, second to that, this person mentioned BV. So BV is bacterial vaginosis. That is actually an infection that requires its own antibiotic. So if you have BV, they actually need to treat you for that. BV is not a sexually transmitted disease, although we kind of lump it into that category. It's basically an infection where some of the bacteria that's kind of prevalent in the vagina will basically overgrow because the vaginal flora has changed. Now, going back to the two antibiotics that she mentions, both cefuroxime and coamoxiclav are safe for use during pregnancy, and both are also used all the time to treat urinary tract infections. Another question that I got to kind of wrap up this area, I'm going to wrap up antibiotics and I'm going to answer your question, Obapa. I'm 26 weeks pregnant. My doctor has prescribed me ciprofloxacin 500 milligrams twice a day for 3 days because of vomiting and diarrhea. Is it safe for my baby? That is also another medication that is safe for pregnancy. However, ciprofloxacin is a little bit stronger and not one of our first line choices. So it's a risk versus benefits question. If they feel like based on your profile, maybe you're at high risk for preterm birth, maybe they've tried other things, maybe they did swab it in a lab. If you swab it in a lab, sometimes against the bacteria, we can tell what antibiotic will work best. But for whatever reason, they picked a stronger antibiotic, but it is safe during pregnancy for a short-term use. So that's a good question. For those of you who are joining me, hi, I'm Dr. Samantha, the maternity mentor. Please feel free to put your questions into the chat. And for those of you who wait until the end, I'll tell you what my video is coming out tomorrow. So, am I going to have an epidural for the C-section? Please explain it for me. I'm a first-time mom. So you are not going to have an epidural, and I actually have a video on this. You are going to have a spinal, which is extremely similar. So, Obapa, I don't know if you're aware, but I have a ton of videos on C-section. Check them out. What they're going to do when they admit you, what it looks like in the operating room. I think there's one of what to expect. There's definitely one on what to expect for the first 3 hours. C-section scars, you name it. We should have a whole thing on just C-sections. So you have a lot that you can look at. Now, as far as the epidural versus spinal basically comes down to the space that they put it in your back. That's it. There's really no other major difference. It's the same procedure and everything. The difference is they're going to do this in the operating room versus if you're like a laboring mom and you are in a labor room, they'll do usually the epidural there. When you go in, they're going to have you curl up, like they're going to have you curl your back. This is one of the biggest things that people don't quite understand. If you've ever seen like a Halloween cat, So at Halloween, you know how you'll see those pictures of frightened black cats and their back is all raised up, kind of curled over? That's actually what they want you to do. They want you to curl your back, and that's why they have you hold on to a pillow, because it opens up the spinal bones to give them a spot to put the needle in. Now, the part that actually hurts is the numbing. That's actually the part that you're going to feel. And so understand, it's going to feel, they say like a bee sting. I would say that's probably the most accurate way to describe the actual stick. And then it's followed by a burn. And it's an intense burning sensation. It's burn, 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 burn. What you need to understand is they're not in your spinal column at that time. So a lot of people get really nervous because they feel the sting and they kind of pop, and you don't want to move. You want to try to stay as still as you can, but they're actually just numbing the whole area around it. And then that burning is simply that lidocaine solution kind of getting in there. Now, once that happens, everything else you don't feel. It's basically just a little bit of pressure. So they use a needle and they go in, and then they take the needle out, and all that's in there is a soft piece of plastic. Just like an IV has that soft piece of plastic, there's no needle left in your hand. And then they just put a whole bunch of tape and they lay you down and they just inject fluid into there, which has the numbing agent. Now, once you get ready, the way they know it's working is that they put the drape up and then they test it. And what they do is they actually pinch your belly pretty hard right at the spot that they're going to do the cut. When I say pretty hard, I've been on the other side. And so if you can feel it, you'll know it. Now, once they start the C-section, because this is where a lot of people get really scared, you are going to feel stuff. C-sections, you feel pressure. You will feel sometimes intense pressure because they're going to potentially push on your belly a little bit to help get baby out. It's just very, very normal for you to feel that. Sometimes that can be a little scary. Your anesthesiologist will give you medicine if you feel nervous, and they won't give you medicine that will put you to sleep, but they'll give medicine to you that allows you to still stay awake to meet your baby, but be calmer. The other thing is if you get nauseous, which can happen, they'll give you medicine for that as well. That's what your anesthesiologist is there for. The only other thing I would tell you about that is if you know that you're going in for a C-section, like let's say you know you're going in on Friday and you know you've had some kind of spinal I guess I'm going to call it injury. I'm not sure that I like that word, but that's the word that's coming to mind for me. Basically, if you've ever had a car accident or a slip disc, or if you've had scoliosis or any kind of back surgery, you can actually call ahead of time a lot of times, and you can actually ask to meet with the anesthesia team ahead of time. See, the nice thing is when you're having a planned C-section, you can actually kind of get some of this stuff in a row. And if you go ahead and you meet with them ahead of time, then what they can do is they can actually assess your back ahead of time and take a look at it so they can kind of prep ahead of time if you have anything going on. It is extremely rare nowadays that we can't do a spinal or an epidural, but there are a few times that we can't. Okay. I feel like it's thunderstorming here. So if I lose my internet, I'm so sorry, guys. Hi, Jade. Does being at risk for hypothyroidism have anything to do with being pregnant? My doctor told me I need to watch my numbers for the future, but I've never been told this until pregnancy. Does being at risk for hypothyroidism? I'm not sure I know exactly how you're asking the question, but I can definitely talk about this. And I actually have a question on thyroid. So if you're experiencing hypo or hyperthyroidism, but especially hypothyroidism before getting pregnant, it will absolutely affect your ability to get pregnant. Your thyroid gland, in my opinion, is like the number one gland or organ in your entire body that's important. So we think about like heart, brain, lungs, but the reality is the thyroid controls all of it. It controls all of your cardiovascular system. It controls like your temperature. It controls like your weight. It controls everything. It's so important. Hypothyroidism, that means low thyroid, that can cause you to gain weight. It can cause constipation. It can cause depression. It can cause you to lose your hair. It can cause dry skin. It can cause slow heart rate. So much stuff. Hyperthyroidism, you can also lose your hair. You get super thin. You get these bug eyes. You can get a big goiter. Your heart can race. You can get anxiety. You get hot flashes. Oh, hypo, you get cold intolerance. You get freezing all the time. So these things are basically affecting your autonomic system. And if left untreated, it can lead to serious consequences. So one of the things that you need to do is you need to make sure your thyroid is in check. And so if your thyroid is not in check, not only can it affect the pregnancy, but it can actually affect the baby. Babies can develop a thyroid condition if mom has a thyroid condition during pregnancy. We need to check your thyroid levels constantly during pregnancy. They may have you testing anywhere from every week to every month and adjusting your medication accordingly. It's extremely important that you stay medicated with thyroid, or you can actually have miscarriage, preterm labor, and all sorts of other stuff. She explained my numbers are low, but not within a range to take medicine that helps. Okay. It could be that you're borderline low, but unless that's a maternal fetal medicine doctor, I would be requesting to see a maternal fetal medicine doctor. Maternal fetal medicine doctors are the doctors that take care of high-risk pregnancies. So they're the ones that deal with all the complications you might see during a pregnancy. And an MFM is the one who is specially trained to actually deal with this or send you to like a reproductive endocrinologist. Endocrinologists are the doctors that take care of hormonal conditions, including diabetes, thyroid issues. They can take care of like different hormones like testosterone and female hormones. So, but I would not be just leaving this to a regular OBGYN at all, because there's other risk factors involved. And I'm going to ask a question, and please don't think of this as anything, but Jade, what race are you? And I ask this because, unfortunately, at least here in the US, women who are not Caucasian oftentimes will get worse care during their pregnancies. This is well known. This is a huge epidemic that we're facing. And frankly, if you are anything but Caucasian, depending on which doctor this actually may not be sound advice. It doesn't mean your doctor is a terrible person. We're starting to just realize that there's some built-in bias that providers aren't even aware of. But if you are not Caucasian, and you're not being told this by a maternal fetal medicine doctor, then I would say it's a risk. So being that you're an African-American woman, Jade, you may want to seek a second opinion if that is possible, because unfortunately, African-American women are at the number one risk for poor care in the United States. Now, I will say this. If your high-risk doctor is saying it's not appropriate to treat right now, but your high-risk doctor has a plan to recheck your levels in a reasonable amount of time and to be following this closely right up until the end, maybe, right? But they should be checking your thyroid levels every 3 to 4 weeks. And if you're symptomatic, sooner. Okay. So that's extremely important. And I had a question on my thyroid video this week, and it's great that you're asking this, Jade, because then I can just tie this in. It said, I don't think this was from you. My TSH level is less than 0.005, and I'm 10 weeks pregnant. I'm super anxious. Does it affect my baby? And the answer is yes, it does affect the baby. What's happening is when your TSH is low, that means that you're hyperthyroid. So let me just explain a couple other things. We look at a couple different levels. The first one is TSH, which is thyroid stimulating hormone. Thyroid stimulating hormone does exactly what it says. It stimulates the thyroid to make the hormone. The hormone is T3 and T4. I'm not going to get any further into that than that because then it gets complicated. But if your TSH is high, your thyroid hormone should be lower. And if your thyroid hormone is higher, your TSH should be lower. Now, in the normal range, it goes like this. When you have an extreme abnormal, something that's way outside, so the TSH in this case is way low, that means you're in hyperthyroidism, and that is no good. Amongst other things, hyperthyroidism, your heart can race at 200 beats per minute. Your blood pressure can be sky high. That can create a kind of dynamic in the body that's not good for the baby. If you are hypothyroidism, like you, Jade, it's possible that your blood pressure won't actually be high enough to actually cause placental perfusion to be as good as it could be. So it's definitely something that you need to be aware of. And the other thing you guys should be aware of is that any woman can develop a thyroid issue at any time during pregnancy and any time postpartum. It's actually extremely common for women to develop a thyroid issue within the first 3 months postpartum. So that's another thing to check into. Very often, I have women coming to me for postpartum depression or anxiety. I'm in psychiatry. And when they come to me, one of the first things I check is their thyroid. Because if they're anxious, it could be hyperthyroidism. And if they're depressed, it could be hypothyroidism. So it's very, very important to get checked out. I hope that helped, Jade. And I really hope that in like when I'm asking your race, I really hope that you understand it's very respectfully. I just really want everybody to get very good care. And it's something that has to be said, unfortunately. So I kind of mentioned this earlier, so I'm going to go ahead and answer these, which are TDAP questions. These are on my TDAP vaccine video. TDAP is tetanus, diphtheria, and pertussis. So it said my gynecologist in Dubai says I don't need a vaccine. Is this right or not? And then my gynecologist asked me to get this vaccine at 24 weeks. Is that okay or not? So these were two different questions that I got. So I kind of alluded earlier that women are immunocompromised during pregnancy. So when you're immunocompromised, you're going to be at higher risk for issues. And so we do recommend a lot of vaccines during pregnancy for that reason. Specifically, a couple that you guys would be familiar with is flu and COVID-19. And just like the flu and COVID-19 is recommended for somebody who's 70 or 80 or somebody who's got like a history of a transplant or something, we're trying to prevent serious illness and hospitalization or death with them. It's the same thing for COVID and for the flu with a pregnant woman. We're trying to prevent serious illness, hospitalization, or death. TDAP, and now the new RSV vaccine, which I have a video on RSV vaccine that we can link. TDAP and the RSV vaccine are actually not as much for you as it is for your baby. So tetanus, diphtheria, pertussis. I am a huge, huge, huge proponent of this. So tetanus and diphtheria aren't really the big deal. It's pertussis. Pertussis is whooping cough. So whooping cough is a virus, and in an adult, you can get it and not even have symptoms. And if you do get whooping cough, you can actually get whooping cough and you don't cough. So that's not something that's very common for that's not how it presents in adults. But in babies, whooping cough can be deadly. And I'm from South Florida, and it's endemic. Pertussis is endemic, which means it's within our community in Miami. And we've actually had babies die of pertussis or whooping cough. So as a result, we are a great example in South Florida of why the recommendation exists everywhere to get the pertussis vaccine or the TDAP vaccine. When we get vaccinated as a pregnant person, what happens is we develop antibodies that get passed to the baby. So the baby gets some immunity passively through the placenta. Additionally, because I'm protected, if I go in the community and I get pertussis or I get exposed to pertussis, I'm not going to get it and bring it home to my baby. So I'm also protected that way. Babies can't get a pertussis vaccine for like, I think it's over 6 months right now because it's a live vaccine. And when babies are born, they are also immunocompromised. And therefore, they can't get any live vaccines until they're older. So babies are unfortunately not able to get the vaccine to protect themselves. So we have to do everything we can to give them passive immunity and to protect the mom and to protect any other family members and caregivers that might be with the baby. So like in the hospital, our staff all got the TDAP vaccine because it allowed the staff to be vaccinated to not bring it into our patients. A lot of nursery schools will have that. And you can request, if you get a nanny or a babysitter, you can request for them to get that. And a lot of OBGYNs will actually encourage your family members to get it. Now, you can get it basically in the second trimester on, so 26 weeks is fine. As for the person in Dubai who is being told not to get it, one of the things I am going to tell you is, listen, the RSV vaccine is a great example. The RSV vaccine also creates passive immunity for the baby, but it is only recommended if delivery is going to take place during RSV season. So RSV has a season like flu. It's not year round. So if you're delivering in a place that has RSV only for 4 months out of the year and you're not delivering during that, they don't recommend it. So in Dubai, it is possible that pertussis is not endemic to your area, meaning it's not within the community, and therefore maybe it's not something that you need. The only other thing I could think of is that maybe there's something within your country's guidelines that has changed about the care for female health, and it could be based off the product that's being provided to you guys or stuff like that. So that could be why. Any of you who are joining me, please feel free to put your questions into the chat. I'm finishing up on some of the questions that we got on the channel as well. Bed rest. Is it safe to drink prune juice? Because I'm very skeptical and scared of taking medications while pregnant. I only take prenatal vitamins and water, and I just started drinking coconut water. So bed rest. A lot of times when you're on bed rest, one of the bad things that can happen is you can get constipated. Now, it's already hard if you are taking prenatal vitamins because prenatal vitamins constipate everybody. But then if you're not moving around, you're not walking, that puts you at increased risk for constipation. So a very common homeopathic remedy is prune juice. Prune juice often is a great way to help us naturally go to the bathroom. So what I would say is this. Most of the time, there are 2 exceptions. Prune juice should be just fine, okay? Exception number 1. If your doctor does not want you to have a lot of bowel movements, when does this happen? If you have an incompetent cervix, that means a cervix that's not strong enough and kind of tries to dilate on its own. We don't want you to push. We definitely don't want you pushing and bearing down to have a bowel movement because that can lead to you like causing the cervix to dilate more. But at the same time, we don't want you to have a bowel movement like every day. We want you to kind of be modulated. So sometimes women will be nervous. They want to have a bowel movement every day. They don't want to even skip a day, but the doctor doesn't necessarily want you to do that. So if prune juice was to make you go every day and that's not what they want, that could be a reason. Number 2, gestational diabetes. So gestational diabetes is a serious issue, guys. And if you have gestational diabetes, you have to be very, very careful of your sugar intake. And prune juice is high in carbohydrates, aka sugar. Even if you get real prune juice, it is still very high. It's a fruit. Fruit has sugar. So if you're not doing well in controlling your blood sugars, prune juice is not your optimal, ideal way to kind of go to the bathroom. Now, while I understand it's homeopathic, it's not like taking, say, Dulcolax, right? Which is a laxative that you do not take unless your doctor has told you can take it, and is definitely like hardcore. If you are diabetic, you also don't want to increase your sugar level too much. Okay. So that's something to take into account. Moving along with food, We have my video on superfoods, and somebody said, I don't know what to eat because I'm sick and I feel very weak. Nutrition is extremely essential when you're pregnant. You need to feed yourself and you need to feed your baby. However, a lot of women have a lot of morning sickness in the beginning. It's very common. And so if you're having a lot of morning sickness, you just go one bite at a time if you have to. When I was pregnant with my 2 kids, I had hyperemesis gravidarum. That is extreme morning sickness. And I was sick every single day. I lost 30 pounds with one of my pregnancies. And I went bite, 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 bite. And I would hold a bite in and I'd say, I just have to keep it down for 15 minutes and I will absorb some of it. So sometimes that's what we do. But our bodies are amazing. And they're going to strip us of everything to make sure your baby is doing well. The body will really provide all the nutrients the baby needs. So you just keep going to the best of your ability. The final couple questions, let's see. I actually did have a question that was kind of a one-off on urinary tract infections. I have white blood cells and red blood cells in my urine. I am pregnant and I don't have any symptoms or problems. Even my doctor didn't talk about it to me. Should I be worried? So, it's hard to say. I went on about urinary tract infections. White blood cells and red blood cells do usually mean an infection is there, but there's a lot of talk right now about not treating asymptomatic or infections that don't have symptoms because of all the antibacterial resistance. If your doctor didn't say anything at all, you need to call your doctor. You need to call your doctor because, to be very honest, maybe they didn't see the result. Maybe they didn't pay attention. No offense. Who knows? The second thing is you can ask to be retested. Maybe it was a lab error. Maybe you didn't wipe well. If you don't wipe well or something, that could be half the issue. So maybe you need to get retested to verify whether you have an infection or not. And then you need to ask the risk versus benefits of not treating and what to look out for, what to know if it changes. I mean, I can tell you if you get a fever, if you get pain, if the urine starts to smell, if you get symptomatic, if you just don't feel right. Those are all reasons for you to get checked out. Increased heart rate. But you need to be told this by your healthcare provider. So I would encourage you to go and ask them more. Ask more questions. And I'm going to tell you, I very, very often will get a lab result with a patient that's kind of off. It's like not a lot off, but it's a little off. And I just say, let's retest it. Anything could have happened. And so instead of just, especially if you're not symptomatic, instead of just assuming something's bad or ignoring something, let's just retest. Let's create a pattern. Let's validate, meaning confirm that's there, or let's get rid of it. And if it wasn't there and you're not symptomatic, then probably don't need to worry about it. It's probably a one-off. So that's one of the things you can do. The last couple of things that we had were on labor and delivery. One said, I'm 38 weeks and 4.5 centimeters. What can I do? Definitely check out my video on how to induce labor naturally. I'm actually hoping this person at this point has had the baby. Unfortunately, sometimes I get questions on the videos and it's a week later before I have my live. But that would be what I'd say to do. And the final one was, I want to know the signs of having a boy or a girl. And I debated, I went back and forth with answering this just privately. We're going on here. But I can answer that question. If you want to know if you're having a boy or a girl, you can do any of the genetic testing. I have a video on genetic testing that I can link into the description, or you can get an ultrasound. Other than that, there's no other way to do it. There's no, all the old wives' tales. You will hear them, but for every 9 times out of 10 that it's correct, there's the one time that it's not. So there's just, if you want to know, it's an ultrasound or blood test. So thank you for those of you who stayed until the end. I'm Dr. Samantha, the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as any questions that you put into the chat. We're on social media. Please feel free to check us out over there. Please share the channel with your friends and family. Please like and subscribe. Subscribing helps me out as a content creator. And I want to thank you guys so much for getting me over 30,000 subscribers. Yay! Part of this has helped me to be a part of the YouTube health platform. This is an area of YouTube where they verify health providers to ensure that you're getting this content from somebody who actually knows what they're talking about. For those of you who stuck around till the end, tomorrow's video is on polyhydramnios, aka having too much amniotic fluid. Polyhydramnios is a condition that can happen. It has its own set of consequences for both you and baby and requires extra monitoring. And it is commonly associated with gestational diabetes, which is becoming more common. So please check out my video tomorrow. Hit the notification bell when you subscribe, and you will be notified when that comes in. I appreciate all of your support. I hope that you are enjoying every bit of this like I am. I love interacting with you guys. I look forward to speaking with you again on another Monday night. My name is Dr. Samantha. I am the maternity mentor. Bye for now.